All right, Nisha the PA, we are live.
Hey guys, so today we have my gorgeous patient. Now we are 2 weeks post-op for a couple of procedures and 3 weeks post-op for others. I'm going to start off with a little bit down below. So she had a little bit of concern with some more sculpting needed down to the lower area and some loose skin. So we actually did a spiral thigh lift. Now, I know one of the more concerning things about a spiral thigh lift is to really hide the scarring, and then how big that scar will be. So I want you guys to first take a look at her before pictures of her thighs. A little bit of dimpling to the lateral aspects. Not as well defined down there. And I'm going to show you where her scar is when she turns around in just a second, so you guys can kind of see how we did our spiral thigh lift and how we're able to hide the scar. You have a very minimal scar. So I'm going to have her turn around. And this is where we have the scar hidden. She had a little bit of a double roll back there that was kind of one of her major concerns and she wanted to address. So I'll take a look at this area here is where she had that double roll. And now look at her about 3 weeks post-op with her spiral thigh lift. You can see the scar is pretty well hidden within kind of the natural folds of her body. Very, very minimal. And this is only 3 weeks post-op. This is without any type of lasers to also further help minimize the scarring. This is just how nicely she's healing with our aftercare protocol. This will continue to heal. It'll continue to get better. And this scar is really going to be unnoticeable by the end of it. Now, while we're in the back, we also, in addition to the spiral thigh lift, we had some fat grafting to the buttocks. And I'll have you guys kind of take a look at that. And along with fat grafting, we had Selfina. Now, Selfina is used to release some of the dimpling that you have, some of the dimpling that's tethered down. We can go ahead and cut that little tethered part and make it a nice smooth area along with fat grafting. So some of that dimpling you saw to the lateral aspects of her thighs, a little bit down below, we were able to take care of that and to smooth it out. So her buttocks looks a lot more rounder, a lot smoother. And then I'm gonna have her turn back to the front and talk to you guys about a little bit more things that we did to kind of improve her physique. So we did a liposuction revision on her abdomen, which is the reason why we had to do a full tummy tuck. A mini tummy tuck. And you can see that with the scar. Once again, the scars look so well. 3 weeks post-op. This is 2 weeks post-op for.
This is not even 2 weeks.
Not even 2 weeks post-op. And look how great this looks. Her abdomen looks a lot more smoother. We did fat grafting. We did liposuction, internal heating with Renuvion to go ahead and give her a lot more definition, a lot more leanness in the abdomen and the flanks area. And it looks so good. Go back to before. You can see in the before picture, she had a little bit more problem area right here around her umbilicus. And now look at it, it's a lot smoother. Not even 2 weeks post-op. And so remember, right after something like this, you're going to have a little bit of swelling. Now, of course, that swelling will decrease with the appropriate aftercare, with your lymphatic massages. But as time progresses, these results will only get better and better. So it's going to improve. So even though she looks amazing now, just wait a few more weeks, a few more months, and she's going to look even more phenomenal. Now, we're going to move up just a little bit. We also did a breast revision. And correct me, but we switched from silicone.
Saline.
Sorry.
Okay, guys. All right, guys. We went from saline to silicone implants because they are much lighter and they feel better for our patient.
So much better for you, and in her case, much better for her. So 2 weeks post-op for the tummy tuck, 3 weeks post-op for the spiral thigh lift, the internal heating with the Renuvion. And so right now, she has a little bit of swelling on her, but not as nearly as much as she had right out of surgery. And of course, this swelling will go down, and her physique was just going to keep improving.
One more thing I would talk about my arms, because my arms.
We had her arms. Her arms
one
look.
of my favorite parts.
Oh my goodness! Let's literally look at her arms. We have to mention her arms.
It's like one of my favorite parts.
I'm gonna move to the side so you guys can see the difference between the before. Yep, just like that. The before and after of her arms. Look how much smaller they are, guys. So good.
It literally is one of my favorite parts.
have so many favorite parts, but
I know.
yeah, that is a really good part of one of the things that we did.
And guys, someone's asking why she needed a mini tummy tuck. Guys, she needed the mini tummy tuck because her previous surgery left her with a lot of scar tissue. If she was a primary case, she wouldn't have needed that.
Yes, which is why I only will come here from here.
Okay, so those are a couple of the things she had done with us. Kind of to recap, she had the spiral thigh lift, a mini tummy tuck because it was a revision case, and we had to remove some of the scar tissue she had in there, internal heating to keep everything nice and tight, self-feeding to the buttocks area, and fat grafting to get rid of some of the dimpling.
Do your face?
Oh, we ready to go to face? Yeah.
All right, guys. So we did do some work to her face. We made her the super snatched look right now. As you guys can see, we did tons of work right there. The non-surgical facelift is basically what we ended up doing. That consisted. So that consisted of face tight in her first surgery. We did Morpheus 8. We did a CO2 laser to resurface her skin, and then we also did plasma pen, Moxie, BBL.
You can see right
And
here
she
the
did use
reason
our
she had
airfly
some of this dimpling is because we did some threads for some lifting.
That is called the Mega Lift, guys. We use Insta-Lift threads, and then we use PDO threads for the eyebrows. If you guys watched our live, you guys could watch the whole procedure there with that.
And you guys, this is 3 days after that procedure. Go watch that video.
Look how good she looks. Just the overall tone and texture of her skin has improved. She has a nice little glow. We did the Aerify kit on top. A nice glow to her skin. She had a little bit of redness that we were able to improve, some textural issues. You can just look at her lateral profile and you can see the lifting that she already has from the threads. Just kind of take a look at these lower jaws, which is very typical as we get older. You tend to start to sag in that area, and we were able to give her kind of a dramatic improvement with the Nova threads and the PDO threads. Now, of course, one of the other things that we did to her upper area was Morpheus 8, which is, once again, is going to help with skin tightening. And of course, those results are going to just continue to improve as time progresses. But even now with the CO2 laser and Moxie and BBL to help with the brown and red spots, she already has dramatic improvement in her tone, her texture, and just kind of a really great glow to her skin.
All right, guys. Thank you, Nisha. It was great. We'll keep you updated on our patient status. All right. Thank you, guys.
All right, guys. See you next time. Bye.
Yay!